Okay, I'm washing my hands now. Um, all right, washing my hands with alcohol gel. Then I'm putting on the gloves. Putting on the gloves. Okay, now I'm wiping off my stethoscope. Okay, okay. Right down. Then I'm checking your ID van. Can I please check your ID van? Your name and ID, date of birth. Okay, that's all good. Okay, I'm going to introduce myself. Hello, Mr. Dan. I'm Abbas. I'm your nurse. I'm going to be performing the assessment on your ears, nose, thorax, lungs, right? And during this assessment, I'll be touching you in different places. Would that be okay to you?
Yes.
Before we start the assessment, would you like to go for urination?
No, thank
No?
you.
Okay, so I'm providing the privacy to you. So privacy is provided. All right. So this one is done. Privacy. So I'm gonna ask you a few questions. Um, you have come with some problem, medical problem. I want to know if you have any history of asthma before.
I do not.
Never had.
No,
Okay. Do you smoke?
I do not.
No. Do you have cough with productive and non-productive cough?
Not
No.
at the moment.
Okay. Did you have any discharge from your ear? Never. Okay. Is it the first time you had your shortness of breath?
Yeah, first time.
First time?
Yeah.
Okay. Do you have any allergies?
No.
If I'm asking. Okay, so these are my 5 questions. Um, now I'm gonna start the assessment. So first of all, I'll inspect your ear. I'll start the assessment from the ear. I'll inspect your. So I can see that the ear are symmetrical. There's no discharge from the ear. Now I'm gonna palpate your ear. Okay. So this is Pina. I'm gonna palpate it. Do you have any pain? Do you have any pain?
Oh.
No pain?
Oh.
Okay. So make sure that you sit in such a way that you come in the video. So no pain. No. So Pina is palpated. I'm gonna palpate the tragus.
Mm-hmm.
Tragus. Do you have any pain?
Nope.
No pain.
Nope.
Okay. I'm gonna check your mastoid. Do you have any pain? No
Nope.
pain. So no pain, no tenderness in Pina, tragus, or mastoid. So now I'm gonna be doing the whisper test. In whisper test, I'm gonna occlude one of your ears,
Mm-hmm.
and I'll say 3 words. You'll have to repeat. Okay?
Okay. King. Win.
Okay. Say loud.
Oh, king win.
Okay.
Create.
Okay. Now I'm gonna, so 3 words I have already said. Now I'm gonna include this here and then say 3 words again.
Shirt.
Good. Salt.
Salt.
Cream.
Cream.
Good. So I can see that his hearing is okay. Now I'm gonna do the otoscopic examination on his ear. So otoscopic exam. Because my client is adult, so I'm gonna pull the pinna up and back, and look how I'm holding the otoscope. My this pinky finger is touching the cheek here, so that the otoscope does not go inside. So, so I can see that the external auditory canal is pinkish in color. I don't see any discharge in that. Okay, let me see the tympanic membrane. The tympanic membrane is poorly gray. Okay, and it does not have any what do you call it? So okay, so it's pearly gray and it does not have any. Um, okay, so when tympanic membrane is pearly gray, um, it does not have any bulging. So it does not have any bulging. I can see that it's no bulging. Let me check the other ear. So now I'm holding the stethoscope from this hand and touching this. Look, how I'm holding it. So I can see that the same thing. The external auditory canal is pink in color. There's no discharge. Then you have tympanic membrane is pearly gray and there's no bulging in it. Okay. So this is otoscopic examination on Mr. Dan. After this, I'm gonna go for nose. So can you please lift up your head so I can check the nostrils? So I can see that the uh, nose is symmetrical, and the tympanic, nasal uh, nasal turbinates are pink, and they're moist. I can see that nasal turbinate is pink and moist, and and nasal nasal cavity, uh, nasal septum. The nasal septum is in the midline, and it does not have any perforation or polyps. Okay, so I can see that. Okay. Um, Now I'm gonna do the cranial nerve number one test on you. So what I'll do is I'll occlude one of your nostrils, and I'll give you something to smell. Okay, and you'll have isna, isna. So you will tell me what. Please close your eyes. Close your eyes, please. Okay. Tell me, what did you smell?
Soy sauce.
Okay, good. Okay, close your eyes, please. Now I'm gonna occlude the other nostril. What did you sniff?
An orange.
Orange. Okay. So I can see that his cranial nerve number one is intact right now, because he can sniff and tell what he has sniffed. Now I'm going to be doing the examination on his mouth and pharynx. So when it comes to mouth, let's start from the lips. So I can see that the lips are symmetrical. They don't have a lesion. I don't see any cracks on the lips. Um, Now, can you open up your mouth, please? Okay, let me check. I'm going to use the tongue blade. Okay. Yeah. Say E.
E.
You know, close your teeth. Close your teeth. Say E.
E.
So no. Okay. Open your so I can see your. So okay. Open. So I can see that the gums are not bleeding. They don't have any swelling, and teeth are a little bit yellow, but they are all in a line. And I can see. Can you open it? So I can see some of the teeth have dental caries in them. So this was the examination. Now I'm going to be checking your tongue. Okay. So okay. Can you open your mouth wide, please? A little bit wide. Can you lift up your tongue, please? Okay. So I can see that the tongue does not have any lesions on it. The dorsal surface of the tongue is pink. It's rough, um, and it has some trash on it. The ventral surface of the tongue is, I can see that it's shiny, and it has veins in it. And the bottom of the mouth is moist, pink, and it does not have any lesions on it. Okay, thank you. So this was the examination on mouth. Uh, Now what I'll do, I'll check the heart palate. Can you please open up your mouth again? I want to check. So now I'm going to be checking the heart palate. So I can see that the heart palate is whitish in color, a little bit. Yeah. And the soft palate, open up your mouth, please. Yeah. Alright, so I can see the soft palate is pinkish in color, and hard palate is whitish, and it has rugae in it. And both hard palate and soft palate, both of them don't have any lesions on it. Thank you. Now I'm going to be checking your cranial nerve number 9 and 10. The cranial nerve number 9 is called glossopharyngeal nerve, and the 10 is called vagus nerve. So what I'll do is, can you say ah? Okay. So when he says yeah. So when he says ah, so I can see that the uvula and the soft palate both rise as he says ah. Okay. Now I'm gonna be checking your cranial nerve number 12, which is hypoglossal nerve. Can you stick your tongue out, please? Out completely. Can you move it from side to side? Okay. So I can see that the tongue is out. Can you say light,
Tight.
tight,
Tight.
dynamite?
Dynamite.
So I noticed that my client, his phonation was clear, and there was no, I didn't see any tremors in that, and his tongue actually was able to come out and go side to side. So this is cranial nerve number 12, which is hypoglossal um, nerve, and it's intact. Okay. Now I will be doing the examination on neck. So I can see that the neck is symmetrical. It does not have any lesions, no scars. I don't see any scars on the neck, and the trachea is in the midline. You can see that. After this, I'm going to be palpating the neck from behind. Okay. Let me palpate the neck from behind. Okay. Do you feel any pain?
Oh.
No pain?
Oh.
Okay. So, can you swallow, please? Okay. Again, please. So I noticed that the patient swallowed, and I didn't see any signs of thyroid enlargement. And as the patient swallowed, the thyroid went up and down with the swallow. Okay. After this, I'm going to check your carotid artery. Okay. So can you please remove this? Okay. For your carotid artery, I'm going to put one by one. So first, 2 fingers here. I just want to check your carotid pulse. Okay. Okay, good. Now I'm going to check the carotid pulse here. Okay. So I can see that the carotid pulse is um, um, it is regular in rhythm. It's strong, and it's equal bilaterally, because in both sides I noticed that whatever the pulse was here, the same was the pulse over this. It's equal bilaterally. Okay, now I'm going to be checking your cranial nerve number 11. Okay, cranial nerve number 11 is, I'm going to ask you to shrug your shoulder. Can you shrug your shoulder against my resistance? Okay, good. Now can you rotate your head against my resistance? Very good. Can you rotate your head against my resistance? Yes. So I noticed that the cranial nerve number 11, which is actually spinal accessory muscle, is intact, because the patient is able to rotate his head and shrug his shoulder against the resistance. Okay, now I'm going to be checking your integumentary MK system. So for integumentary MK system, I'll be checking the upper extremities. So upper extremities are your shoulder, elbow, wrist, and your hand. Okay. So I can see that by inspection, I can see that the color of the upper extremities is normal. I don't see any paleness. I don't see any cyanosis. The color of the skin is as the rest of the body. Okay, and I don't see any. Do you have any lesions here? I don't see any lesions. No lesions. I don't see any involuntary. Can you stop your hand? So I don't see any involuntary movement in your hand. I can see that the upper extremities. I don't see any involuntary movement in your upper extremities. So I don't see any. And also I see that your upper extremities are symmetrical. And I can see that the hair distribution in your upper extremities is normal throughout everywhere in the upper extremities. Now I'll be palpating the upper extremities just to check the temperature. Okay. So what I'll do is I'll remove my gloves because with the gloves I would not be able to check the temperature. So I'll remove these gloves. Okay, I'll check the temperature of the upper extremities. Okay, so I can see that the upper extremities are warm and dry. I don't see any signs of edema. Okay, I don't see any signs of edema. Do you have any pain?
Nope.
No pain?
Nope.
Do you have any pain here?
Nope.
No pain?
Nope.
No pain here?
Nope.
So I don't see any signs of pain or tenderness, and to see any sign of no signs of edema, swelling, and I don't see any masses also. Okay, let's check the turgor of the skin. So if I pinch the skin, so let me pinch the skin here. I pinch the skin went back to normal very fast. Yes. Now I'll be checking the nails. So let me check your nails, please. So I can see that the color of the nail is pink. The color of the bed of the nail is pink. They are not flat; they are rounded. And let me check the capillary refill. So if I press this, within 2 seconds the color came back. This is capillary refill. Now I'm going to be checking your thorax and lungs. So the external thorax. So can you lift up your shirt, please, a little bit? Completely, please, if it's possible. Thank you very much. So I can see that the external thorax is equal bilaterally. It's symmetrical. It's conical in shape. Um, um, uh, Symmetrical, and I can see that the um, um, respiratory rhythm is same. It's not different. But my patient has already complained about the shortness of breath, and I also hear the wheezing sound. So now I'm going to be checking the um, um, in the thorax. I'm going to be checking the anterior posterior to transverse diameter ratio, which is, I can see that because he's adult, I can see that anterior posterior to transverse diameter is 1:2. Now I'll be palpating. I'll be checking the tactile femidus. So for tactile femidus, I'll put my hand, when I put my hand on your chest, you have to say 99, okay?
Yeah.
Okay,
99.
okay,
99.
okay.
99. 99. 99. 99. 99.
Okay.
99.
So I noticed that the tactile femidus is equal bilaterally throughout the length. Okay, now I'm going to be checking your. I'm going to put in my fingers in the in this area, the under the typhoid process. So typhoid. So his um, ribs are here. So typhoid process is here. So I'm going to put my finger here. Can you please take deep breath? Again, please. Okay. So I noticed that both the lungs expanded equally. So it means when he took the deep breath, both lungs expanded equally. It means the chest expansion was symmetrical. Okay. Thank you very much. Sorry, you have to go back because I'll have to do the auscultation. Okay, now I'm going to be doing the auscultation, and in auscultation I'm going to be going for three sounds. One is a bronchial sound, the other one is bronchovesicular sound, the other one is vesicular sound. And let's check. So I'm going to be using my stethoscope for that. Okay. So for bronchial sound, I'll start from the bronchial area. Okay. Please deep breath. Okay. Oh, sorry, I've not put it in here. Okay, please deep breath. Okay, deep breath again. Okay, deep breath again. Deep breath. Deep breath. So I noticed that the bronchial sounds were harsh, they were loud, they were high pitched, and I noticed that the inspiration was almost equal to expiration. Let me check the bronchovesicular sound. So for bronchovesicular sound, I'm going to start from the first and second intercostal spaces, which are on the left side of the um, forgot the name of that thing. Anyways, so I'm gonna start from the first and second intercostal space. So, okay, please take deep breath. Okay, good. Take deep breath again. Okay, good. Take deep breath. Okay. Take deep breath again. Thank you very much. So I noticed that bronchovesicular sounds were not as high pitched as the bronchial sound. They were low pitched, they were tubular, and um, um, what do you call that thing? Mm. Inspiration was almost equal to expiration. Now let me check the vesicular sound. For vesicular sound, I'm going to start from the apices of the lungs. Okay, yeah, straight. Okay, yeah. Take deep breath, please. Take deep breath. Yeah, keep taking deep breaths. Okay. Okay. Take deep breath. Take deep breath. Okay. So I noticed that the vesicular sound were not very high pitched sound; they were low pitched sound, and the inspiration was less than the expiration. And this concludes my assessment. Thank you very much.
Thank you.
Let me check.